Well, the Somerset NHS Foundation Trust today became the first NHS trust and the first non-private sector organisation in the world to introduce the Allurion Gastric Balloon. The first two NHS patients to undergo the procedure were treated at Musgrove Park Hospital in Taunton. Well, joining me now is Allurion's co-founder and chief executive, Dr. Shantanu Gaur.
We've developed a solution that delivers short-term weight loss, but also long-term weight maintenance. Our patients will lose 15% of their total body weight in just 4 months. But because of our behavior change program that we deliver alongside our balloon, because of our AI-powered remote monitoring platform that we deliver alongside our balloon, our patients actually maintain 95% of that weight loss 1 year after the balloon is gone and out of their body.
What are the pros and cons to this type of treatment then?
So the pros are that it's non-pharmaceutical, so you're not using medicines, therefore less likely, hopefully, to get side effects. And secondly, it doesn't involve an operation like a gastric band or a bypass or anything. The cons to it, though, are that it's not going to be a magic bullet. It's not going to fix everything. And you probably will need to use it alongside other measures, such as changing your diet, changing your physical activity, and making sure you make long-term changes, because this isn't going to last forever.
Good to have you on the show. Fascinated by this story. So maybe you will explain what it is and how it works.
Thank you for having me on. I founded Allurion back in 2009 when I was a medical student at Harvard. Really got interested in obesity and diabetes, and back then bariatric surgery was really the first line therapy for people with obesity, and it works by reducing your stomach's volume. What we've done at Allurion is actually create something completely non-invasive that can accomplish something very similar. And the idea is very simple. You swallow the balloon, it comes in a small capsule like this. It's attached to a tube. The capsule goes down into your stomach and you fill the balloon through the tube. And after about a 5-minute fill time, you have a balloon that is about ½ a liter in size that remains inside the stomach. And the balloon stays inside the stomach for 4 months. And after 4 months, there's a patented valve in the balloon that we've designed to open. The balloon empties and passes out of the body naturally. So we've developed something that can be delivered in a 15-minute office visit, and then literally 4 months later, it disappears out of the body. And we've actually taken great lengths to make sure that the balloon is just part of our program. We have developed our own behavior change program, AI-powered coaching system and remote monitoring platform, so that patients not only lose weight quickly and safely, they're able to keep that weight off in the long run, which is really the holy grail in this space.
Joining us to tell us is consultant weight loss surgeon Dr. Simon Monkhouse. Simon, thank you very much for your time. We've talked about how it works. Going to be used on the NHS. In terms of weight loss, how successful actually is it?
Good morning. Thank you for having me. So, yes, it is very successful, and patients can expect to lose between 10 to 15% of their total body weight during that 4-month period that the balloon is in situ. So for the average person, that could be 2 to 3 stone. And you only need to lose 5 to 10% of your total body weight before you see the health benefits. So, reduction in hypertension, high blood pressure, reduction in medications for diabetes, etc. So it is a non-surgical alternative that seems to be very effective. And I've been placing the Allurion balloon for, I think, 5 years now. We've done over 1,000 placements and we have some excellent results.
After 4 months, how successful then is it? Because you can imagine, great, you've lost 15% of your body weight. Well, precisely.
So the point of this is not actually the balloon. The balloon is part of what this is. This is a behavior change program. So if during the 4 months you work with a dietitian and you have some digital technology, artificial intelligence now we have with it, and it's designed to be a behavior change program, so that during that 4-month period where you are not feeling hungry and your portion size is reduced by the balloon, you work on your relationship with food. And there are studies out of Italy particularly which show that 96% of the weight that was lost is still off at 12 months. So there is 12-month data after the 4-month balloon.
This is used 6 months apart. How much weight did you lose during the 4 months where the balloon was in your stomach?
So during the the 4 months I lost 2 stone, and then went on to lose another 1 stone. So about 3 stone in total that I've lost.
Have you now sort of maintained that now? So that you trained yourself not to go back to any old habits or any old bad habits, anything like that?
Yeah, so I've kept all of the weight off. It's been 9 months without the balloon now, so about a year since I got it inserted in the first place.
This is you now looking amazing.